Throughout the storied history of Carlinville area hospital and clinics, one constant has been the compassionate, quality care provided by our doctors, nurses, and employees. While the hospital has succeeded in offering outstanding healthcare services to the community, perhaps an even greater success has been the sustained culture that defines the relationships these providers have with each other and their patients.
This place wouldn't be what it is without the employees. And right now, we have, I think, the most tremendous employees around that go out of their way to help their fellow community members. And I think it's always been that way. I mean, in a small community, when you know everybody, and if they're in the hospital and you're an employee, you're going to take care of them the best you can.
We have a number of those employees who drive here from cities who have a hospital and choose to work at this hospital. So that tells us a little bit about the atmosphere for employees. That's pretty awesome.
It's a team effort. It's not just your own individual effort. I think they all work together in the same fashion to do whatever the best is for the patient or whoever's needing treatment.
I've been so impressed with the providers, the staff, and the board of directors that have created a really amazing foundation for us to build and grow as an organization. Over the last few years, our focus in our clinic system, creating a great engine for our organization to provide local primary care, and the comprehensive support of our specialists are probably some of the biggest accomplishments we've had. We have good coordination with our radiology department and with our phenomenal rehabilitation department in supporting Dr. Walters in his orthopedic surgeries.
So the culture at Carlinville Area Hospital is a very good culture. As any workplace, culture is very important, and we take that very seriously. We've had many exceptional providers and staff within this organization over the 17 years I've been here. Some of the attributes they have in common are professionalism, expertise in their areas. It's a family feel, and they show great commitment to the organization, to our patients. And we like to have a little bit of fun along the way. What we do is very serious work, so it is good to have some fun and relieve some of the stress.
It's just trying to figure out more things that we can do here that save somebody a trip to Springfield or St. Louis or another medical center. It's more of a convenience. We can do it here, and probably we can do it cheaper than what it is in Springfield.
If you were to think about our hospital going forward, additional projects and things that will come in the future, really just continue to revolve around the expansion of our clinic system, the enhancement of our specialty clinic spaces. One of the things that has been exciting for our organization as significant accomplishments is the advancement of local care. Our orthopedic service line is an area that many folks have that need. And what we have been able to do is work with our orthopedic surgeon to not just perform the basic surgeries that you would expect here, but to perform a more advanced level of care, which would be our total knee replacement program. And as we've grown, we're starting to recognize that some areas of our very beautiful hospital here may need some additional expansion, whether that's our surgery department or some other areas.
Carlinville Area Hospital and Clinic is important to Carlinville and the surrounding communities because it provides access to not only healthcare services but to expert care. We bring experts in their fields from all over the region where they can be seen right here in Carlinville. They don't have to travel long distances. They don't have to worry about the resources to be able to travel those long distances. So they really are getting top-notch, state-of-the-art care right here in Carlinville.
We have been able to take the foundation that's been built and create new service lines that serve our community in a way that it never has before. We want our community to be able to look at Carlinville Area Hospital as a comprehensive rural health system, and having built that, we know that we're now able to reach out to folks for aspects of their care that they've never been able to receive here before. So as I look to the future, who we are today and who we will be in the future is really driven by who we've been in the past. The stability of our organization, the leadership and guidance that our board and previous medical staffs have had to help us be who we are today has created a foundation for which we can launch into our plans for the future.
Just like the physicians who opened the hospital in 1952, Carlinville Area Hospital and Clinics is dedicated to providing expert healthcare locally. This dedication has defined us as a comprehensive rural health system and will continue to define the care we provide for the next 70 years and beyond.